Welcome to Have You Heard with Heather Darling. I'm Heather Darling, and today's guest is Dylan Dubois. Dylan is with Prestige Rehab, and welcome to the show, Dylan.
Thank you, Heather. I really appreciate your time today.
It's great to have you here. So you've got some great information for a large segment of our population. People are living longer than any other time in history at this point, and it's a trend that's likely going to continue with advances in healthcare and medicine. So how does therapy extend the vitality of seniors and how they're able to live and enjoy their lives?
Of course, that's a great question. So as you age, obviously, your body tends to decondition. Your muscles might, atrophy. You might lose muscle tone. You might actually lose muscle mass. Things can happen with your musculoskeletal system. There's a lot of things that go on as you age. And keeping active, just generally, and even if it's not even in a therapeutic sense, just generally staying active, moving, not only from a mental standpoint helps you with releasing the endorphins, but from a physical standpoint, you are keeping your muscles from wearing away. You are improving your muscle tone. You are increasing your muscle mass, and you're further just kind of widening the divide of what age can do to your body overall as time progresses.
So there's different forms of rehabilitative care for seniors.
Yes.
Let's start with physical therapy. For our viewers, what is physical therapy?
So physical therapy is really more of the physical modalities that are being done. So I'm going to touch on what physical and occupational therapy are because a lot of people don't really know what the difference is.
Right.
So when I got into this business, I was actually one of those people that didn't know. So quite easily put, physical therapy usually deals with everything below your waist. Occupational therapy deals with everything above your waist, usually. So physical therapy, you're going to see a lot more things that have to do with the actual movement of the muscle, the repair of muscle, the more functional mobility of things. Whereas occupational therapy is more so helping you do the daily tasks that you need to do utilizing said muscles. Does that make sense?
It does, but that's interesting because I've had shoulder surgeries and I've always gone to physical therapy.
Yeah.
So when you segment it, I mean, obviously shoulders are above the waist, and I've had physical. Occupational seems to be more, to me, how to eat, how to, just basic, like you said, how to function on a daily basis.
Exactly.
But it's a little more complex, I think.
It is, and I'm glad you said that. So physical therapists are able to treat the full body. That's a unique difference between physical and occupational therapy. So occupational therapists are actually not able to treat below the waist in a typical clinical setting. Physical therapists can treat your whole body, which is why you were able to go for your shoulder.
Right.
However, let's say you have an issue with maybe like reaching up to a cabinet to grab like a jar of something, or brushing your hair, or showering. That's really more where occupational therapy would come in, because it deals with the actual thing you need to do that the muscle or the joint you're working on would limit you from doing.
See, that's interesting because I went to physical therapy for exactly those things. After it sat for 3 weeks, it needed some more help.
Exactly.
So now, what is speech pathology? Because that's another modality here.
Speech pathology is really more for, we see it a lot of use in patients that have maybe had strokes. And just have a difficult time with, articulating themselves. A lot of times, and you can even do certain things when it comes to swallowing. Sometimes those who are memory impaired and also involved with the stroke too have issues when it comes to swallowing. So there isn't typically as much of a need with speech pathology as there is for the other two treatment modalities.
Right.
But speech is just really more guided with typical linguistic exercises, like maybe repetition of a certain word or sentence to try and break habits, and even things like stuttering, for example. But more in the geriatric community, it has to do more with someone who's maybe had a stroke, or somebody who's becoming a little bit more memory impaired that has difficulty speaking and perhaps even swallowing as well, we say.
So are these modalities typically employed due to a catastrophic event like a stroke or something, or are they just employed in some cases as individuals age for vibrancy?
So it's a great question. I mean, as far as physical and occupational therapy is concerned, you typically do have to have some type of ailment, because as therapists, we couldn't treat you for nothing.
Okay.
But like you said, as you age, it is very, usual that you will have some part of your body that is deconditioning. and there's going to come a point where you need to work on it. And it usually is the better thing to choose and elect to do before surgery.
So what is an adult daycare?
It's a great question. So when we founded this business, we specifically were looking for assisted living, but we didn't know what adult daycares were. So quite simply put, an adult daycare is a full circle of life. You start as a kid, and you go and you get taken care of, you get fed, you have activities, you learn. It's the same thing, but as you're older. And it's really interesting. So they have breakfast, they have lunch, depending on how late they stay, they get dinner. They are playing bingo. They have different, for example, field trips. Like they might go out to Walmart or the grocery store, or for religious purposes, they might go to their local temple or their church. It's really a place for a senior that might feel kind of locked at home and not really in much more of a social light to really go build friendships, sharpen their mind, stay active, and really, I believe it helps tremendously when it comes to aging.
Is physical therapy typically covered by Medicare, Medicaid, or is it out of pocket for seniors? How is that taken care of?
Great question. So usually insurances do pay for it, and I'm glad you asked that. I have some statistics here from a monetary sense about the differences between utilizing therapeutic remedies versus a surgical remedy. Now, when you have surgery, usually following a surgery, you're going to have some type of therapy.
Right.
Now, what we're aiming to do is hope to get you to a point where you really don't need the surgery. However, on either end of the spectrum, they're useful. So to answer your question shortly, yes, Medicare does pay for physical and occupational therapy, speech as well. Medicaids usually do as well. It is something, I can't speak for 100% of the companies because I don't know all their individual policies. But usually, yes, insurance does cover it.
And do you need a prescription?
No, actually. So in New Jersey, we have something called direct access. Direct access basically means that as a physical or occupational therapist, and this usually, I'm going to speak generally, but it really does go for most, if not all, clinics throughout the state. That means you can walk into a physical therapy clinic without a prescription and say, I want to be evaluated for my shoulder or for my leg or for my lower back because I have pain. And what they'll do is they'll treat you, they'll evaluate your condition, and then what's going to happen, in our sense at least, we evaluate the patient based on their current ailment, and then that plan of care we create gets sent to their doctor reviews it and signs it and sends it back to us. That actually becomes their prescription.
So the doctor prescribes based on you talk to them about the ailment and they come up with what this is going to be?
Exactly. So for example, we might have a patient that comes in, with like bilateral knee pain, both of their knees hurt. And we're going to assess them based on, let's say, how high their pain level is, how the pain, what was the onset, what does it restrict you from doing, and we create a full plan of care from top to bottom and we have 2-week, 4-week, 6-week, 8-week, 12-week goals, and we increment it that way so they can see, okay, these are the barometers we're looking to hit, and these are the milestones that we're going to put in this plan of care to hope that this patient gets to at least that point by 12 weeks or however many weeks from now.
So let me ask you this. Going back to adult daycare, some of these facilities have PT in-house, correct?
Some do, and also some don't. We've come across a fair amount that don't. We've also come across a fair amount that do. Okay. We really have seen that there is more of an untapped niche, so most really do not. But to us, it's really super beneficial because what goes on is when you go to an adult daycare, you're being bused from your house. It's the same concept as, for example, going to school as a kid, or a teenager. You're getting bused from your home to the adult daycare, and there, you kind of want to stay there, especially in the nature of a pandemic, because if you're going to the daycare and then you have to go out to an outpatient facility, whether it be your primary care doctor, or in this case, a physical therapy office, you have to go there, come back, and you don't know if they bring something back. But it's also logistically kind of a nightmare because, they're being bussed in, then they got to get bussed out, bussed back, then bussed home. So,
what is the average, cost for busing per person?
To be honest with you, I do not know that question. That's more of a daycare-specific facility question because we don't deal with that. We don't have a transportation component of our company because all of our clients and patients are actually on site where we treat.
I'm going to assume that there would be some kind of savings associated with not having to do the transport, because a lot of the transports that I see, they're more of an ambulance type than a bus.
Yeah.
So I would assume that that requires some significant, elevation, de-elevation to get chairs, things
Yeah.
like that in.
Yeah. And so, for example, like, let's put it in the sense of an adult daycare, for example. And really, we can put it in the sense of like someone coming from their home. Um, from a daycare's perspective, obviously fuel costs are rising egregiously, and every ounce they use, no matter how they use it, they obviously have to refuel, and the more trips they take, the quicker that happens.
Right.
So this is kind of cutting out that component for the daycare as a whole, utilizing less fuel because they don't have to bus everyone out to maybe 2 or 3 or 4 different locations. They can keep everyone there inside.
Well, is the Medicaid, do they pay for the transport as
They do,
well?
yes. The Medicaid usually pays for the transportation, and the daycare is usually the one that facilitates the transportation, so it all goes to them.
Okay. So, in other words, the funding then would come out of the pocket of Medicaid taxpayers, not necessarily out of the daycare for most of these individuals.
Yes.
Do you know how much is saved on average by insurance or by the state or the individual on an annual basis in transportation costs, or that's a function of things outside of your
It's more
scope?
a function of things outside of our business, but I do have the answer to that in regards to physical therapy and rehabilitative care versus a surgical option.
Okay.
Because, for example, if you suffer a fall or whatever it may be, any accident, and you have to go the surgical route, or the surgical route's an option, or the physical therapy route's an option, there's a vast difference in cost. So I wrote down some general statistics, and these are general averages throughout the United States. So the average ambulance ride is about $1,200, and that's probably on a fairly average or maybe even low end. So let's say you fall, you need to take an ambulance, so you're already at $1,200. Now let's say you need to get a knee replacement because of the fall or something happened so catastrophically that needs to occur. Those range anywhere between $10,000 and $52,000
For the surgery?
for the surgery.
Okay.
And then the average range of, let's say, a spinal surgery, if you have anything like a cervical issue, lumbar, thoracic, wherever it may be, could be anywhere from $8,800 all the way up to $70,000 or more.
And so for people who are watching who don't know, cervical, lumbar, thoracic is all sections of
So
the spine.
cervical is more of the upper part, thoracic is the middle, lumbar is the lower part of your spine. And then the average cost to insurance, so let's talk about therapy now. So the average cost to insurance, Medicare, for physical therapy is about $100 a visit. That's typically what a in or outpatient facility would be paid insurance-wise. Now, a typical prescription is written for about 2 to 3 times a week for anywhere between 4 and 12 weeks.
Okay.
So I did basic math. So at the minimum amount of times a week, maximum, I apologize, for the maximum amount of times, which is 3 times a week, at the maximum amount of weeks, which is 12, your insurance will be paying about $3,600 for that whole time frame. So if you're thinking $3,600 to insurance just for rehabilitative care versus perhaps going to get a knee replacement, which is already at a bare minimum of $10,000.
Right.
There's obvious cost savings there.
Right.
But that's not to say that the surgery might not be necessary. We're just saying that this is the better first step to take to see if it's avoidable. If it's not, then you need to take care of that. And then afterwards, you still might get therapy.
Right.
But even then, that's
Usually
still going to
it
prevent
works.
you from happening again.
Right. So we have to take a quick commercial break. We'll be right back with more of Dylan Dubois and Have You Heard with Heather Darling.
Awesome. Thank you.
Hi, I'm Bob Hochgertle from Kings Road Brewing Company. I'm here to tell you about a brand new show on RVN Television called Cooking with the King. Each week, we're going to taste and sample some of the best beers the Kings Road Brewing Company has to offer. And we're going to talk to area chefs and restaurant owners as we pair our beer with their signature dishes. We're going to teach you how to cook and eat like a king. Cheers.
A stroke can be easy to detect. A loved one can't speak, perhaps they can't move. But there's another sign of a stroke that many of us can't see. It's called spatial neglect, and it can occur during or after a stroke, causing distorted visual movements. Fortunately, there's a solution by using optical prism technology during rehabilitation. If you or a loved one have experienced a stroke, ask your doctor about spatial neglect. Spatial neglect. See the whole picture at KesslerFoundation.org.
Are you?
Welcome back to Have You Heard with Heather Darling, and we're here today with Dylan Dubois, who's discussing the benefits of physical therapy, exercise, and rehabilitation for seniors. So, Dylan, do adult daycares or assisted living facilities typically offer classes like yoga or exercise or things like that that would increase blood flow to the brain, that would help with balance, so that it would prevent falls and also increase mobility?
Yes. So there are many differences between an adult daycare and an assisted living center that, you know, I find are very obviously unique to each model. And wherever you are at in your pace of life, it kind of would depend on which one you would choose. So in the sense of, let's say, an assisted living is really more for somebody who is a little bit more in need of a more consistent level of care. Someone who needs more of a watchful eye and really isn't that safe at home. And it's also obviously for someone like, for example, if you're sending your mother or father there and you work full time and you have kids, you might not be able to provide them for that much care.
Right.
So in that sense, that's the better option, is to place them in an assisted living, because they're getting the constant care from morning to night as to what they need, dietarily, exercise, and so on and so forth. So usually every assisted living facility has on-site physical and occupational therapy. It's built in. So whether that company decides to do group exercise is also another thing. Most do. I know our company does provide that, but it is a very important thing, because what's really the model of assisted living is not only to keep your health intact, but to stay active. Mm-hmm. And really the best way to stay healthy is to stay active, right, physically and mentally.
Right.
I have seen yoga. I've definitely seen group exercise, and obviously things like bingo, for example. It really is like, it's the most important game I've ever seen. Like, all of our daycares, all of our assisted living centers, like bingo is like a sacred time of day. It's the most important thing. It's so funny how serious they take it. But
can they win? Is there money involved?
No.
Okay.
Usually no money, but they'll get like something to take home, like a dish soap, or like a bottle of disinfectant wipes, something. But it's just more the community that they share. Mm-hmm. But to your answer in regards to exercising, so yes, it is very important, and for most assisted living facilities and adult daycares, that exercise and mental, physical mobility and strengthening is implemented throughout their course of their care, whether it's at a daycare or an assisted living facility.
I mean, obviously, having those increased fitness levels, as you stated earlier, is going to help with preventing falling. It's going to help with mobility. It's going to help with confidence overall. It's going to help to prevent bone wasting, muscle mass wasting, all the things that happen naturally as you age, as your hormone levels decrease, so you have less ability to support them, you have to maintain it better.
Yes.
So is this something that you find more rehab facilities and assisted living getting into?
Well, now, yes, because especially if you think about it, the last 2 years, the pandemic impacted this very greatly. Because you have people of really all ages, but speaking specifically for the geriatric community, that have been home for 2 years, mm-hmm, not active, mm-hmm, at all. Mm-hmm. There's for example, there was a daycare we were speaking with where they are having a hard time getting some of their clients to come back because they've just been bedridden for so long, they physically can't move. They can't, mm-hmm, make it from bed to the bus. Right. And that might be a 1 minute long walk, or if that.
Right.
So, yeah, it is something that is becoming a lot more heightened in the eye of adult day, outpatient, inpatient, and assisted living, because it's really needed now, I would say more than ever, just because of the amount of internal deconditioning that's gone on throughout the pandemic.
That's interesting that you say that, because, right, the adult daycares were closed. Mm-hmm. Assisted living was open, yes, because that was residents that, yeah, they typically purchase. Mm-hmm. So it's an interesting scenario, because there are people that I know of, their parents were literally in a room, yeah, the entire time, in an assisted living facility in a single room.
Yes.
I can't imagine.
I can't either. And, the end-all be-all is that physical activity is, to me, it's so important in my own personal life, but to me is one of, if not probably in my opinion, the most crucial thing one can do to stay young. Some of the patients that we have that are the oldest, we have patients that are in their upper 90s, almost at 100. They are yogis and they teach yoga. They exercise every single day. I have a patient who walks 4 miles a day. She's in her 80, probably like 86. And anytime, because being young, I'm always like, how do you get to this part? How is it that you got here? Every one of them attribute it to active, consistent exercise.
100%, I agree with that. So would you say that there are intangible benefits to this as well? And if so, what are they? I mean, obviously we've got groups, we've got physical activity. A lot of people seem to have different levels of social interaction in our lives. Some people, they're more to themselves, and other people are more gregarious. And it seems to me that as time goes by, those that are more introverted become shut-ins, and it's a very difficult life. So how does this help with that?
So the beauty that I've seen is that, first of all, another thing about the pandemic is it has also increased, unfortunately, the level of the demand for mental health, awareness. And even before this, there is a statistical, a very high statistical amount of the geriatric population that suffers from depression and loneliness, whether they're widowed or whether their parents, have passed on. Most, unfortunately probably have, or their kids might not have the time to see them that often, their grandkids, and they're alone a lot. And that alone can wear you away. It can make you not want to be physically active. It can wear you just down completely from top to bottom, inside and out. So one great thing that the adult daycares and assisted living do is they give you that community. They give you a social atmosphere once again. They give you the sense of belonging. They give you the sense that you really do matter, because we all do.
Right.
But you can forget that when you're locked away alone all the time and you're like, okay, I lived all of this time. I'm 80, I'm 70, I'm almost 90, and I'm alone.
Right.
And loneliness is something that can just really deteriorate somebody forever. It can really get to you. And the importance of these two types of facilities is to really take that away. That's an intangible to me that can, make it a good option for anybody, is that you get to go somewhere where everyone is probably around your age group. They're, you probably share similar interests because you might have grown up in the same time period. You almost get to relive your youth. Like I've seen some, some residents in assisted living facilities, like, they'll be talking about like, Frank Sinatra, for example, like, with a fellow friend of theirs, and they were like, oh, remember this back in the day? I saw him here. And it actually is good for their memory because they're now having neuro associations with this time in their life, and it improves not only their, present mental well-being, but the fact that they can recall memories. So the intangibles are, first of all, like I said, the sense of community and the sense of belonging and the sense that you're not alone. And then just the overall activity. You have the option to do things, and it's actually being made for you. You don't really have to think.
Right.
All of these things like, okay, bingo's now, lunches now, dinners now, breakfast is now, therapies now, let's go to a field trip. There's so much activity, you really start to feel alive again, and I've seen it. And the other interesting thing, this is more for adult daycares, there tend to be more ethnically diverse. So I see, a lot of our patients are from India, China, Egypt, Spain, and all throughout the world. And the interesting thing is when you have clients or patients that are, right from these countries, they miss them. But then when they get to associate specifically with others that are from the same towns, same cities or states or anything within that country, they all get fed the cultural food too. Like the Indian clients get their, they might get their Gujarati cuisine or their Punjabi cuisine that they're used to eating. It gives them this sense of getting back in touch with their culture. So it's great from so many different angles. It's spiritual. It's great from a cultural perspective. It's great from a social perspective, a physical perspective. All in all, I think they are two of just the best options you can seek out.
What about comfort level? I mean, I would assume that when you've got a senior, right, there's things come with that. They
Absolutely.
fall.
Yes.
And then they have a fear of falling. And they stop. They stop moving because they have that fear of falling. And you said you're a workout guy, right? If you're squatting and you've got your best spotter there, you got a guy that has your back, you're going to do more than if they're not there. Do you find that when they're in this kind of setting with others around them that are doing the same thing and staff around, that they're more willing
Absolutely.
and comfortable with doing, just pushing a little further, exerting themselves a little bit further, which will benefit them in the long run?
Absolutely. A lot of times, like when we begin a new location, we'll start the therapy and we'll start with, let's say 5 patients.
Right.
And then as they start, they encourage their friends.
Okay.
Because it's also interesting. It almost becomes this like sense of status. Like I'm getting treated, so I want to get treated.
Okay.
Like why am I not getting treated? But all in all, they begin to get encouraged to be seen, because one thing with, we've seen at least with the geriatric community and seniors is that, first of all, change is very difficult. Mm-hmm. And they're not as, easy to accept it.
Right.
So it's really our job. It's part of our job to help them understand that it's okay that you're aging. But we always say this, the golden years should be your best years. Why not?
Right.
There's no reason that just because, like you're in your 20s, that those are your best years.
Right.
You can live to your 100 and make them your best years. Your best years could be from 80 to 100. It's how you make them. So
it's a good way to look at it.
And it is the truth, at least from what we see. And, I really believe age and everything is in the mind, and where you are in life. But they do get encouraged by the staff, and they do get encouraged by our staff and the daycare or the assisted living center staff, because they care, we care, and their friends care, and they really do make friends. It's truly interesting. It's like daycare when you were younger, but now, and it's very heartwarming to see, honestly.
They didn't have daycare for everybody when I was a kid, so daycare was like my cousins.
Yeah.
Yeah,
I used to go, and there was this one bicycle I used to always love to ride. Don't know why I remember it. I used to go to kindercare. But like, I'm serious. What I've seen in daycares, I've seen so much activity. When I get to that age, it's not out of the question.
Okay.
And I'm a very independent person.
Right.
But I still think it's a great option. It really is.
And now you know what to shoot for.
Absolutely, yeah.
Dylan, I want to thank you. I know the time flies. I have a few more questions that I'd love to ask you, but I got the wrap it up sign, and we have to terminate it here. But thank you so much for coming on. I hope that some of our viewers were able to learn something that may be able to help themselves or a family member down the road. No, I really appreciate you having me, and I hope the same for all of you. Stay well, stay healthy, and if you are having that decision of, maybe placing a loved one in assisted living or an adult daycare, I really hope today helped. And they can truly help the well-being and vitality as you age. And I think they're very important components that are there for your access. There you have it from somebody who knows the field very well. Dylan, thank you so much. Thanks everyone for watching. We'll see you next week for another episode of Have You Heard with Heather Darling.